Heart attack warning. 6 silent signs. Hi, what percentage of heart attacks are silent? 20 to 45%? That's accurate. What do you recall when you consider a heart attack? The majority of people have the impression that all heart attacks are depicted in movies as traumatic events involving someone suddenly fainting or experiencing catastrophic outcomes. It's not always like that, so don't believe the movies. An undiagnosed or mildly symptomatic heart attack is referred to as a quiet heart attack, silent myocardial infarction or MI, or silent ischemia. A person may not feel the severe chest pain that is typically associated with a heart attack in a silent heart attack, but the heart muscle is damaged as a result of the limited blood flow to it. Alternatively, the signs and symptoms could be mild, undetectable, or confused with less serious illnesses. Both men and women can experience silent heart attacks, but particular populations such as the elderly and those with diabetes are more likely to do so. Smoking, high blood pressure, high cholesterol, obesity, a family history of heart disease, and diabetes are risk factors for silent heart attacks that are comparable to those for typical heart attacks. Do you want to learn more about silent heart attacks and the 6 warning signs you should look out for? Stay until the very end of this video because it contains vital information that could save your life or the life of a loved one. We are aware that heart attacks are the main reason people die in the US and around the world. According to the American Society of Cardiology, over 700,000 Americans nationwide die from cardiovascular disease each year. Keep an eye out. But before we proceed, have a look at the video. Make this video the channel's all-time record in likes by helping out and subscribing to the channel. The more likes a video receives, the more YouTube will view it as relevant and share it more widely to raise awareness. To receive notifications and share this information with your friends and family, ring the bell if you haven't already subscribed. Is a quiet heart attack different from a regular heart attack then? Well, they both have the same underlying causes. The symptoms, however, are different. The heart is a muscle that needs blood that is rich in nutrients and oxygen to continue doing its job of pumping blood throughout the body. The coronary arteries, which provide blood to the heart, get blocked during a heart attack or stroke, and fatty plaques build up inside the arteries. Since the signs and symptoms are a silent heart attack and are usually faint or non-existent, they frequently go unrecognized or are misdiagnosed. Some people may have symptoms including slight chest discomfort, shortness of breath, exhaustion, or overall malaise. Others may not exhibit any symptoms at all, and a heart attack may not be identified until after the fact through medical examinations or testing, such as an electrocardiogram (ECG), or blood tests that measures cardiac enzyme levels. What signs of a typical heart attack are present in addition to a silent heart attack? Less than 5% of the population, the American Society of Cardiology reports, is able to recognize the signs of a heart attack, thus it is important to recall the symptoms. Number 1. Discomfort or pain in the chest. Although chest discomfort is a well-known sign of a heart attack, it can appear in a number of different ways. The center or left side of the chest may feel tight, compressed, painful, or pressured. It may radiate and be sporadic or constant. Chest pain can occasionally be misdiagnosed as indigestion or muscle ache, delaying medical care. Number 2. Discomfort or pain in other areas of the upper body. Although the most well-known sign of a heart attack is chest pain, some people may also feel pain or discomfort in other upper body regions. This can apply to the shoulders, back, neck, jaw, arms, especially the left arm, shoulders, and even the stomach. The discomfort may feel like an ache, pressure, tightness, or squeezing. Any strange feelings in these places should be carefully monitored, especially if they come and go or last for a while. Number 3. Shortness of breath. A heart attack may be indicated by trouble breathing or a sudden feeling of exhaustion. It could start earlier or even at the same time as chest pain. You shouldn't disregard the sense of being out of breath or having trouble breathing correctly. Sometimes, the symptom is misdiagnosed as a respiratory issue or attributed to being out of shape, which delays the diagnosis of a heart attack. Number 4. Unexplained fatigue. Particularly in women, sudden acute weariness may be an indication of a heart attack. Even after light physical activity or while resting, feeling drained or particularly tired should not be disregarded. This weakness can all be encompassing and can be crippling in its effects. Unfortunately, weariness is frequently ignored or explained away by other factors like sleep deprivation or stress. Number 5. Nausea, indigestion, or stomach pain. Gastrointestinal symptoms during a heart attack are not unusual for certain people, especially women. Among them include nauseousness, indigestion, heartburn, stomach pain, or discomfort. These sensations can range from minor to severe, and they might be accompanied by a feeling of fullness or a burning in the chest. These indicators of a heart attack are frequently disregarded because they resemble common digestive conditions like acid reflux or gastritis. Number 6. Cold sweats or lightheadedness. A heart attack can be detected by symptoms such as cold sweats, clammy skin, unusual sweating, lightheadedness, and dizziness. These symptoms may appear quickly, persist, or come and go. Body temperature and blood pressure abnormalities might result from the body's reaction to a heart attack, which can interfere with normal circulation. It's important to take these symptoms into account along with other symptoms, particularly if they are new, severe, or accompanied by chest tightness, even if they can also be linked to other disorders or even anxiety. Number 7. Unusual or unexplained anxiety. A heart attack may be indicated by feelings of impending doom, worry, or a general unease. Although anxiety by itself does not indicate a heart attack, it should be handled carefully, especially if it is accompanied by the other symptoms listed above. Feelings of discomfort or fear might be brought on by the body's stress response during a heart attack. Sometimes people may only attribute these feelings to anxiety or fear, which can cause them to miss a heart attack. Now that is for the 7 signs of a heart attack. What about a quiet heart attack? If there are symptoms, the issue is that they are frequently misdiagnosed as less significant health issues, which raises your risk of dying from coronary heart disease. Shortness of breath, numbness, or chest discomfort are not always symptoms of a silent heart attack. To be clear, the attack or silent heartbeat may be accompanied by none, few, or unnoticed symptoms. Around 170,000 of the more than 800,000 heart attacks that occur in the US each year are silent heart attacks, according to the American Heart Association. Heart failure is more likely to occur after a quiet heart attack. When it goes undetected at the hospital, the infarction affects the heart and causes further harm. Now let's go over what 6 signs and symptoms of a silent heart attack are ignored. Number 1. Fatigue. Extreme weariness or a lingering sense of depletion may be a silent indication of a heart attack, especially in women. Days or weeks before the big event, this tiredness may set in. It can be overpowering, leading to a sharp fall in energy and impeding on daily activities. People could misinterpret it as general fatigue or blame stress, lack of sleep, or other non-cardiac factors. Unexpectedly, high levels of weariness, however, should not be disregarded as they may be a sign of a cardiac condition. Number 2. Mild discomfort in the chest. Not every heart attack is marked by excruciating chest pain. Some people, especially women, may suffer intermittent moderate discomfort or pressure in the chest. Instead of being a searing pain, this discomfort is frequently described as a squeezing or fullness. It could be misdiagnosed as heartburn, indigestion, or a muscular injury, delaying medical care. No matter how intense, every strange sensation in the chest needs to be taken carefully and evaluated by a medical specialist. Number 3. Shortness of breath. Breathing problems or shortness of breath that don't make sense can be a silent heart attack warning sign. The symptom could manifest itself even when you're at rest. Instead of recognizing its connection to cardiac problems, people wrongly ascribe it to age, being out of shape, or respiratory illnesses like asthma. It's crucial to get a medical assessment if you have trouble breathing, has abrupt dizziness, or notice a major decline in your capacity for exercise. Number 4. Jaw, neck, or shoulder pain. An unnoticed heart attack may be indicated by discomfort, pain, or tightness in the jaw, neck, or shoulder region. Due to the body's nerve connections, this form of pain, often referred to as referred pain, occurs. People who have the symptom might not immediately link it to heart issues, instead attributing it to muscle stress, dental issues, or even tension headaches. Any inexplicable pain or discomfort in these locations warrants examination, especially if it coexists with other red flags. Number 5. Upper body pain. A heart attack may also result in pain or discomfort in the arms, especially the left arm, back, or even the stomach, in addition to the jaw, neck, and shoulders. These areas could feel the agony traveling from the chest. People could delay seeking proper medical care by misdiagnosing this discomfort as muscle aches, digestive problems, or other unrelated illnesses. Last but not the least, number 6. Nausea, dizziness, or sweating. Some people may develop heart attack symptoms such as nausea, dizziness, or intense perspiration. These vague symptoms may have a number of different reasons, including digestive problems, anxiety, or heat. The risk of a heart attack must be taken into account if these symptoms appear suddenly without a clear cause and in conjunction with other cautionary indicators. In such situations, it is crucial to seek prompt medical attention. It's crucial to keep in mind that these silent warning signs might differ from person to person and that not everyone has the same symptoms after a heart attack. Additionally, some people can have a higher pain threshold or a condition known as a silent heart attack, which has little or no symptoms. However, if you have risk factors for heart disease, it's important to be aware of these silent indicators and get medical care when necessary. Call emergency services as soon as you or anybody nearby exhibits any symptoms that are cause for worry. Rapid action during a heart attack can significantly increase the likelihood of a successful outcome. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching!